I think there's a really well-timed opportunity to talk about NCITA after a really fascinating discussion. So thanks, Po, for allowing us as a network to have that discussion. Yeah, my name's Penny Cristinacce, and I'm a member of NCITA, the National Cancer Imaging Translational Accelerator. And we are a national imaging network that are looking at the standardization and clinical translation of cancer imaging biomarkers. And the network is composed of researchers from all across the UK. I myself work at the University of Manchester, and it comes on the back of the Cancer Imaging Centres initiative that ran until 2018, which was separately funded studies, but this is a multi-institutional consortium of all the imaging centres involved. And we work as 3 cross-institutional units that work in synergy across the universities to try and provide an integrated pipeline for the translation of quality assured cancer imaging biomarkers. So our aim is to develop and provide this infrastructure for anybody who wants and needs to use it, both in research and clinical, to really allow access to world-class medical imaging technologies, including some of the quantitative MR methods that we've been talking about today. And the infrastructure is there to support multi-centre imaging biomarker studies, particularly, and make them easier. There is obviously an emphasis on cancer because it's a CIUK funded initiative at the moment, but it is possible that your study may still be able to be supported if it is outside of the cancer arena. So we're really trying to develop quality assured imaging protocols, really trying to look at that end-to-end workflow through from acquisition of the data through to analyses, and the aim being that we can then bridge the translational gaps that we've been talking about and try and move some of this research-based quantitative MR into clinical application. As I mentioned, there are 3 units in NCITA. There's an imaging focused clinical trials unit that can support and coordinate studies and help with trial design, etc. There's a QA/QC unit, of which I'm a member, and we're helping with validation, standardization, etc., using a range of methods such as site evaluation, qualification, assessment of the image quality, and the development and implementation of these quality assured imaging protocols. And we have a repository unit, and they are using the XNAP platform, which you may be familiar with, in order to provide secure storage and sharing of trial data for multi-centre work, and also provide easy access to data processing and analysis tools. And we're also supported by the engagement, contracts management, and the training group, who are helping us work together as a network, but also facing out to the community and telling people what we're doing. So engagement is really key, and that's why we're here and why we are wanting to talk to people at the stall, trying to not just work within our universities, but talk to funders, vendors, the NHS, and as people were mentioning today, patients. I didn't add that to my figure on the right, but I just amended it very quickly because I think that's really important. Trying to enhance that collaborative work between clinicians and scientists, and establish some consensus guidelines to help with certification and adoption. And one of the main things we're trying to establish is an MR core lab to help support translational research into imaging biomarkers, some infrastructure that can be used across the UK. And that's really what we'd like to talk to you about at the stalls. If you would like to come along and find out some questions to answers to these questions, such as how can we help your QMR studies become multi-centre? How can we improve the quality of your imaging data and analyses? And here are some of the results that came from a recent survey that we put out to the imaging community in the UK, which really shows the sort of things that an NCITA MR Core Lab could help with. So I'll round up there. Come and see us, come and have a chat, carry on the discussion that we've had today, which has been really, really fascinating. We're in the MR Networks Lounge, which I think if you come out of the live sessions and go down and left a bit, is just there. And the NCITA booth will be there straight away after this lunchtime, as well as tomorrow and Friday lunchtimes, and you can meet staff from all the different units, and you can also go to our website, follow us on Twitter, and if you're interested in having one of your studies adopted, you can get in touch via the UCL email address. So I'll just close my screen and leave it at that.